Male breasts are a problem that we don't generally talk about, but for millions of men out there, it is a source of embarrassment. CBS 2's Dr. Holly Phillips shows us one solution today.
Good afternoon, Christy. Well, when men develop breast tissue, it can cause a range of emotions, from mild self-consciousness to depression. Some have been known to go to great lengths to cover up the problem, and when other treatments fail, surgery is a welcomed option.
It's emasculating, and it's really embarrassing and depressing.
When 22-year-old Julian Piazzolla was just 16, he developed breasts.
You could imagine how it would feel being in school, going to the beach, going out places, where you take your shirt off, you want to be like everybody else,
The condition, called gynecomastia, is the overdevelopment of breast tissue in men, usually in response to a slight hormonal imbalance. And it's common. By some estimates, 50 to 60% of men have some degree of breast enlargement.
In my practice, gynecomastia is probably the most common procedure men are seeking. And right behind it would be liposuction.
Piazzolla sought the help of Manhattan plastic surgeon Dr. George Lefkovits, who specializes in procedures for men.
I had to do a reduction of his gynecomastia, whereby I did not just use liposuction, but we also took tissue out, breast tissue, plus his breast had to be lifted.
Gynecomastia happens frequently in newborns and boys in their early teens, but in those cases it usually goes away on its own.
In adults, it can be triggered by serious conditions like cancer of the adrenal gland, pituitary or testicles, medications like steroids and epilepsy drugs, and substances like alcohol and marijuana can be to blame. But more often than not, it seems to happen for no reason.
It doesn't hurt you, but psychologically it's very disturbing.
I remember nothing from the procedure. I remember walking in and being greeted by the doctor and getting dressed for the surgery and waking up.
Piazzolla says recovery was easy and the procedure changed his life dramatically.
I've dated a lot since then and I had a lot of fun, I got to live.
When gynecomastia is caused by medications, stopping the drugs can help the condition to resolve on its own. And if an imbalance of estrogen and testosterone is to blame, hormonal treatment can be prescribed.
Curious if weight gain plays a role in this condition.
The condition is more common in people who are overweight, but by no means is that the rule. It seems perhaps being overweight may trigger some sort of hormonal imbalance, making them more prone to develop the breast tissue. But it's not necessarily linked, and even losing weight may not help to shrink the breast tissue. So it's not really a cause and effect in that way.
All right, good to know there is some help out there.
Absolutely.
Dr. Holly Phillips, thank you. Chris?